Welcome to the Strong Youth Project, where our mission is to improve organized sport experiences for youth, parents, coaches, and other mentors via education and evidence-based practice. Welcome to the Strong Youth Project podcast. As we work to improve organized youth sport experiences, we will share insights from both scientific research and real-life experiences. Although we will present evidence-based information from the highest quality scientific sources, we also recognize the value of firsthand experience shared directly from athletes, coaches, and parents. These experiences may not always align perfectly with scientific research, yet we believe they still offer important insights into how best to effectively facilitate the many benefits youth sports can offer.
Welcome back to part 2 of the 2-part series of the Strong Youth Project podcast about concussions. This one we'll be talking about treatment and advocating for concussion and some advice that you guys have for us.
Yeah, glad to be back.
Yep. I'm Dr. Steed, a neuropsychologist.
Dr. Campbell, a sports medicine doc, and we work together at Utah Valley Orthopedics and Sports Medicine and run a concussion clinic there.
Awesome. Yeah, let's dive into it. So our first question for both of you is, are there different roles that the sports medicine team, which also includes coaches, parents, and athletes themselves, how do you feel like they can be on the same page with each other? Such as the athlete reporting or sports medicine care or team working with them?
Yeah, I think that's vital. I think just hitting that, it takes a team approach. So really kind of some of the breakthroughs in concussion have happened since we sort of put together all of our experts. And so for our concussion team here at Intermountain, we have our sports medicine docs, we have our neuropsychologists, we have our physical therapists, we have our vestibulotherapists, our vision therapists, our speech and language pathologists that do cognitive therapy. Sometimes we're using audiology, we're using psychology. So this team is how we approach it, because head injuries, your brain regulates all of that. So it's a team. And what we've recognized is that team is even more than that. It's our athletic trainers, of course. It's our coaches, of course. It's our parents. It's the students. It's the administrators in school. So everybody in all of those areas that has a touch point with concussion need to be involved and really on the same page. Now that we're starting to do that more and more, we're seeing some of those changes, and we're addressing concussion from a more holistic approach.
Yeah, and I think as education, which is science driven, becomes is such a key point to helping people manage that, right? So often I hear youth identify themselves as, I am a football player or I am a soccer player. Well, no, you are a youth who plays soccer. There's something different about that nomenclature that I think is kind of driving that education. We need to treat and rehabilitate the entire person to make them whole before they go back and...
I think the science, we're involved in the science side of this from research that we've done, research that we read, trying to stay current. But as we translate that, I think there's some ways that we can be better at translating that to the youth and the coaches and all the people that participate. For example, early on in this care consortium, the University of Florida did a study, and they looked at concussions when they're playing football. And they found that if student athletes sustain a concussion and take a minute or two, or even, they looked at reporting even a 1/4 of that game late after they sustained their injury, resulted in taking 3 days longer to get better. So if I had an injury in the first quarter and I waited until the second quarter to report it, it will take me longer for this concussion to resolve. And that's an important study. As you talk to the athletes and start to, this is going to affect you, but I think we can get you better faster if you're better at reporting, and we get you into the right protocol, take you from play and do that. Then you start to get buy-in. It directly translates to what's going on. And we mentioned Dr. McCrae earlier. He did that study in the early 2000s saying it takes a week to get better, and that's changed. One of the spin-off studies that he did with that is we found that we were able to pull the data from the earlier study, and they found when they returned people at a week, maybe too soon, they weren't better by today's criteria, the number of injuries that they had repeat concussions in the very next game with even longer downtime was significantly higher than when they let it get better. So as you talk to an athlete with that, if you're going to go back and you're not better, it's going to be much easier to have another injury, and that one very well may last longer. That means something to an athlete and a coach. Mm-hmm. So they'll say, okay, I'm going to make sure I'm all better, even if it means I miss one more game, because that's better than missing the next 4 to 6 games. So as we get this information, the way we handle it and the way we look at it and relay that, communicate, that's really important.
Yeah, and so there are a lot of people that need that information, right? From providers to coaches to parents to athletes themselves. And serendipitously, if a youth has a successful outcome, they can be an advocate for proper concussion management with their peers. Oh, yeah. I've seen that happen a couple of times where a youth has come in and they've gone through the protocol. We've got them healthy and they're back doing their thing, and a teammate will come in with subsequently with an injury, and they have modeled their response to that injury after their peer. And I think that's an important thing to consider, is that these youth themselves can be good advocates for good concussion care.
For sure. Yeah, it takes a team, right,
Yeah,
to make it work and happen and recover together. Absolutely. Yeah. What are some common misunderstandings or misconceptions that you've heard that have come from youth or their parents or coaches when it comes to concussions and treatment? Kind of a big question, I know. But
that's a big question. There's lots of them, and it's at different phases. When we think of your head injury, one of those is, I really struggle. I had a concussion. I'm trying to go back to school, but this one class, my math class, gets me every time. That's hard. So I just want to get back to playing football, and I'll let math come along when it comes along. Mm-hmm. And one of the ways we sort of explain that when we're seeing people is, if you sprain your ankle, we focus our treatment on the ankle. Mm-hmm. If we're talking about a concussion and your brain's injury, well, the best way we monitor and test and treat the brain is with brain exercise, which is your math class. Mm-hmm. So you're not ready for football if your brain can't exercise enough to handle math class. So that's one of those. We talked about one when we started earlier too. It's this idea of, was I knocked out or not, and that being a defining factor for concussion. So, just to cut through all the, gray out there, if you were knocked out, even if you felt normal when you woke up, and we see that sometimes, you have a concussion by the definitions. Yeah. And the other one is, if I wasn't knocked out, I don't have a concussion. Right. And that's absolutely false. In fact, a lot of times we'll see someone who has a seemingly small blow to the head, mm-hmm. and they have these persistent symptoms for a long time, and there was no loss of consciousness.
Yeah. I think another thing to consider is the nomenclature that's used. I think sometimes let me back up. Most people get better from a concussion. Sometimes symptoms persist over a long period of time. And historically, that phenomenon has been called post-concussive syndrome. The nomenclature is changing on that, and it's now persisting symptoms after concussion. Sometimes concussion is referred to as a mild traumatic brain injury, which it is. Sometimes it's concussion. And I think those different names mean different things to different people. I've had people think that a concussion where they've been told that they've had a traumatic brain injury means that their life has changed and they're not going to be able to do the things that they used to do anymore. Likewise, I've had people say it's just a concussion. Well, it's not just a concussion. It's something that needs to be taken seriously and treated and managed appropriately. So I think helping people understand the differences in nomenclature and how they describe things, especially youth. Sure. Youth are very good at kind of minimizing complaints or symptoms and things like that, and helping them to find a voice and to describe accurately what they're experiencing and to understand it is really important.
Yeah.
What's some advice you would have for youth to take it seriously, to not downplay their symptoms, not to minimize it, but to take it as it is?
Yeah. That's a great question. I think I would encourage youth to understand that they want to play the long game, right? I know that they might have another game or activity this week, or the snow is really good and they want to get back on the slopes if they've been injured skiing. But they want to play the long game, and it's not going to hurt anything to be cautious, to take a conservative approach, but it might do some long-term damage if you don't take it seriously and you end up getting re-injured before you're completely healed.
I think an important aspect of that, in addition to that, is to look, as we take care of concussions, the way we handle them has changed. We don't go sit in a dark room to get better. We do a lot of testing, and that testing is focused on what's driving most of the symptoms. And so we find that as we do that, sometimes if we get them in the right kind of treatment, we can actually help them feel better sooner. And so this is, a plug for seeking appropriate care. If you go in and seek appropriate care, we can sometimes get you just into the right treatment that can dramatically change that downtime and get you back in action. For example, if someone has primarily visual symptoms, we have a visual program that we can rehabilitate that, do rehab for that, just like you would an ankle sprain, to bring back those vision symptoms and have that functioning better. And we need those. If you're today's world looking at a computer screen, looking at a screen in the front of the class where they're showing a PowerPoint presentation, playing video games, looking at the TV, looking near to far, we can help that get better if that's the main part of your symptoms. Balance can be a major portion of that. We might find some sensitivity to lights and sensitivity to sound, other things that can make a big difference. And so if we get you in and we do that assessment, we can really tailor. It's a custom-made treatment for you, not just this blanket, go sit over there until you're better. And so we can, getting the right treatment early can make a difference in your return time.
I think that's great. And I would just add that we may find a myriad of symptoms, but we'll identify just a few to treat, and we'll start with that. Mm-hmm. And it's kind of treatment for concussion can be an iterative process. Mm-hmm. And so, our goal is not to do all things all at once, but to just take some baby steps, that stepwise recovery that I was talking about, to get better. And so we'll do maybe some vision or some balance or some physical therapy for cervicalgia and see where that goes and see if that helps to clear up some of the other symptoms. If not, we have the next round of treatment and the next layer of
And I think this is probably a good place to kind of give you that average from that care consortium as we look at tens of thousands of concussion injuries that they followed for a college athlete. What they found, their average return to play time, being well enough to go back in and return to play, is just about 2 weeks, which is, I think, more than some people realize. Certainly every concussion is widely different, and we have some that last longer, but that's an average time. So, if someone's thinking, I got to get ready for my game in 2 days, and they're significantly symptomatic, it's good to know those numbers. It takes a little while for this.
For sure. Yeah, it's a little bit more extended than I think what some athletes are expecting, right? Yeah. So to talk about that and maybe have that a little bit more widely known and talked about would be helpful, right? So hopefully that can kind of develop as a discussion.
And I think Dr. Campbell hit on something that is, if you've seen one concussion, you've seen one concussion. And the management of that may be different for different reasons, not only due to the mechanism of injury, but there's a whole lot of developmental history and psychological stressors, all kinds of things that go into play that need to be considered in designing a program for recovery from concussion.
Absolutely. Is there a difference in designing that return to play program between adults and youth?
I think the overall mechanisms of recovery are similar, but I think the implementation of those look a little different for youth, right?
For sure.
Youth, their full-time job is school. That's what they do, and that's very akin to cognitive rehabilitation, right? They don't necessarily have the pressures of a defined role in a household for providing income or things like that, so they may not have those same expectations, but I would say by and large that the mechanisms for treating those symptoms are the same.
Yeah, we just take into account some subtle differences. We look at sleep, for example. That's an important part of the recovery. The requirements of sleep when you're growing, when you're young, are different than when you're older.
Yeah.
So there's some nuances to that. When we look at nutrition and those kinds of things, that's different requirements at different ages. So when we talk about sort of this holistic approach to this, it's important to take those nuances into that. But general principles are similar across all ages. But I really think, as you're seeing certainly in our concussion clinic, every concussion has sort of its own unique pathway to kind of get better, and it's really customized based on the symptom profile, the age, all of those factors.
I would add something for the littles, that sometimes those symptom presentations might look different because young ones are not very good at describing what's going on. Mm-hmm. I remember when my son was about 4, he broke his foot, but the way he let us know is he complained about his sock. His sock was bugging him. And we thought, okay, we'll change his sock. And so when that didn't cure the problem, we took him to the doctor, he got an x-ray, and sure enough, he had broken his foot. And so it may present more like irritability, changes in sleeping, changes in schoolwork, things that might not have a clear-cut, definition, but need to be aware that caregivers need to be aware of and to follow up with those things.
Yeah, I even feel like some parents or coaches even, from what I've seen, will come in and talk about their child having an impact to the head, but then vomiting after. I feel like that's a really popular answer for people to kind of say and talk about.
So our next topic is like a patient's experience. If somebody comes in, they have a concussion, where do they go? What does that look like? What does their office visit look like? Because they would hopefully come in to see both of you, but what would that look like?
Yeah.
Can you walk us through that?
I think there's different entry points for care. So a lot of times you have an injury, if you're in a car accident, you're in something else, it's part of a larger trauma, you're going through the emergency room to be seen. Sometimes people will go to an urgent care. Sometimes they'll see their primary physician to come in. Sometimes they're just at home sort of talking it through. So whatever the entry point is, at some point, if it's a concussion, there's concussion specialty clinics around the country. There's more and more of them. And when we set up our first concussion clinic at the Air Force Academy, from an Air Force standpoint and nationwide for the Air Force, that was really one of the initial clinics that sort of brought all of that group together and defined itself as a concussion clinic. And I think there are more and more of those. And there isn't any regulation on who gets to say that. So if you look at that, we would just recommend that sort of group we've already talked about be part of that. That's the place where if you have a concussion, our brain's pretty important. So as we look at how we care for that, that's the great place to look at that in your community. If you don't have one, in today's world with video conferencing and televisits, we can actually work with and connect with your own provider if you're in a place that doesn't have access to that. And we can work with them and you in that scenario. We have, in Intermountain, we have concussion clinics throughout the state that can help with that. Here at Utah Valley, we've talked about ours. We have a sports medicine clinic with neuropsychologists. We work in the same building. We used to sort of handle things separately, and we found ways to try and make that patient experience better. We go into the room at the same time because people don't love going through their whole description of their injury, too many times. And so if we can capture the information that we both need at the same time, people are happier. And as we get better and better with that, we start to have those resources. We can give you by name this individual that's your next step. And so make it just more smooth and make that process more smooth for people. And in fact, we actually have a meeting every month. Dr. Steed runs that for us, where we bring in all of our team specialists, the vision specialists, the balance specialists, the speech and language pathologists, and we actually talk about cases and challenging cases together so that we're bringing that group in on those, every month. So I think it's worth the time to look into that and try and find that. We still find in some cases some of the old paradigms about concussion care are still being spread. They'll see somebody and say, you got to go home and sit in a dark room until you're better. And we would say, that's absolutely wrong. You will get better slower. There's good research to show you'll get better slower if you do that. Now, you might need that for a day or two, but after that, it's getting into a clinic that's going to tailor make your treatment plan for you will get you through that faster.
Yeah, and I would add that I think that's a great answer, but I would also add that I think part of that initial visit is to help the patient identify themselves as part of their treatment, right? So often they come in, they fill out a symptom severity rating scale, and we review that with them, and we talk with them about that, and we talk with them about after they leave, as they start to return to this activity that Dr. Campbell's talked about, do so up to a certain point. Do so until you start to become symptomatic, and then it's time to take a break. And so helping them understand that they are going to be important in the reporting of symptoms, the monitoring of symptoms, and in monitoring their behavior and what they choose to do with their activity level is an important part of that. And we follow up with them.
Yeah, we follow up, and that's important. We love that. That's the best part of our job is we'll see people come in, and they can be miserable when we see them. And even talking about it, just after we do our testing, they're tired that day they go home. But as we see them through the process, and by the time they're done and you see them, and it's very often an entirely different person. There's a smile on their face. They're happy. They're interacting, and see that change. That's what drives us to want to take care of concussions is to see people go through that and get through this injury.
Yeah. So just backstepping a little bit, when they come in, we'll look at all the symptoms that are associated with concussion, from physical symptoms. Dr. Campbell will do a physical exam, to cognitive symptoms. We'll get background information, because there are some things that are factors that may prolong the recovery from a concussion, and it's important to understand the context of how somebody's doing. So we'll get all of that information. Then we'll step out, we'll put our heads together, figure things out, come up with a plan, and then go back in and present that to them.
Okay. Yeah, no, I feel like that's a game changer for treatment plan, right? The patient on the other side is, just like you said, not wanting to necessarily explain themselves multiple times. So hearing that from both sides and then feel like they have a team that's working with them to support, game changer. How do both of you think how will a patient know that they're progressing successfully towards healing?
That one's a challenging one.
Is.
And we see different ages respond to that differently for sure. We help them with that. So a lot of times we are able to go through one of our tools that we use is called a graded symptom checklist, and they rate themselves. And so we're able to, a lot of times we'll have someone come in and they'll be discouraged because they had this head injury, and they'll come in and say, I'm no better. And as we sit and talk to them and walk through that, they went from not being able to do anything and have any light in a room without it bothering them to they're back at work and they're productive and they're doing things, but they still have a headache or get some symptoms at a certain part of the day, and their response is, I'm not better yet. And so we can help them break that down, and we have some tools to sort of show them. And many times we're like, well, here's where you were, here's where you are now, here's what you're doing functionally, here's how you feel doing it, and show them those changes. And they're like, oh, wow, I am a lot better than I was. I'm just not all the way better yet. And so, following through in that program is part of that process. Concussions, when it involves our head and all of the emotions with that, is discouraging because you're just waiting to be back to where you were. One of the biggest challenges, I think our youth handle this better, honestly, than some of our elderly. Some of our toughest patients with that and where they are and where they were at their baseline is a whole different population, and that can be our elderly patients, and they really struggle with that as they're trying to reference, where was I before this injury?
Yeah, that's interesting.
Yeah. So helping them understand, kind of instilling that hope that, hey, I can get better from a concussion. And sometimes, when you're caught up in the throes of it, it's easy to become a little bit myopic and see, this is what I can't do. And really, to reframe that into hope, I think is a big part of concussion management, and saying, you're pointed in the right direction. We're going to get you there.
Yeah,
Absolutely.
I think that's super interesting because I feel like a lot of people find joy in their hobbies, and they find joy in playing their sports, and if they are taken out of playing that sport, then you see their emotions decline, and you see that they're discouraged as well. And so, do you have any advice for those people who are limited in their sports participation but they want to still keep their emotions up.
That one's, we see it honestly in almost every case. People are frustrated with that process. And one of the analogies that we use is getting better from a concussion is not like flipping a light switch. You don't have the symptoms and then you wake up one day and you're like, I'm better, I can do everything. It's really this gradual process. It's like you have a dimmer switch or you're watching the sunrise, and it's this very gradual process. There's little ups and downs, but if you do it the right way, you can minimize those ups and downs and get to the point where now you're better. And there isn't necessarily that moment where they're like, am I better today? It's a process. And we talk them through that. That's the psychology of recovering from an injury, is sort of dealing with that pressure of I want to be better right now.
Yeah. And some of the concussion symptoms are pretty vague, right? I have a headache. I have, I'm sleeping more than usual. I'm sleeping less than usual. My brain is foggy. I'm anxious. Those could be due to any number of things. And so helping people, as we talked about a little bit ago, recognize that they are making progress and that it's okay to have some symptoms, and that the ideal of having no symptoms, like on this graded checklist that they complete, it's a 6-point scale. I don't know why it's a 6-point scale. Concussion people decided that was important. So expecting all zeros on those symptoms is not realistic, and helping them understand that that's not realistic and it's okay, and to kind of reframe that you may be experiencing some of these symptoms, but it's not due to concussion. Your concussion part is getting better.
Yeah, and I think maybe a great way is just if we were to go and survey college students, you guys are in college right now, so if we were to have college students fill out that scale, how many students would say, I feel on a 0 to 6 scale, do I feel tired today? Do I feel fatigued today? If I didn't eat a lunch today or didn't eat breakfast, do I have a little headache or those kind of things? So in our numbers, right, we look at those. Normal isn't, I have no symptoms. Normal, honestly, on our scales, as we look through that, is kind of 10 to 15, and that's what's normal. So again, we help them reference that and say what would be, a normal response. That's important because you have to have that. Otherwise, it's easy to be discouraged with any injury, let alone a brain injury.
And guess what happens when your moods and emotions get out of whack? It slows down your physical recovery, right? Anxiety disrupts cognition, right? If you're anxious and worried, you're not going to learn and remember as well. So helping them kind of parse that apart and deal with that in a proactive way, I think is such a critical part for long-term recovery.
For sure. And again, working with the team, right, to have those touch points, those reference points as to how to get better as part of that process. We had a question from an Instagram follower that, Bree, if you want to explain.
It says, when should you seek professional help after a concussion?
So I think, probably that that's not as hard as we think, right? If you got hit in the head and, you're wondering if you have a concussion, but you feel 100% normal and you're doing all of the things you normally do, and you're just trying to say, is there an impact? If you're living your life and you have no symptoms, you're probably through that injury. But if you've had this and you have some symptoms, I'm getting a headache when I go to school. I can't, as I try and exercise, my symptoms come back. I'm having trouble sleeping or I'm sleeping too much, then you should go and be seen. By being seen, we feel like we give you the best chance of getting through the injury as quickly as possible, as safely as possible, and getting you back to doing what you want, really in the most efficient way. So it's, if you're having symptoms and it's bothering you, come in and see us. We're happy to see you. We're happy to help you through that process.
For sure. And again, this is for the Utah Valley Sports Medicine Orthopedic Group. So if someone wanted to see them, that's who they would contact as part of that.
Yeah. And of course, it goes without saying that if you're, throwing up or repeatedly or have some serious neurologic signs, you should go and get checked out.
Absolutely. Yeah, absolutely. Okay, we're going to do another transition just a little bit. We're going to go into just some advice, so thoughts on some advice. What are some current research-supported resources for concussion treatments that patients can access and are available to the public?
There's some great resources out there. You can, we talked about the CARE Consortium. They have a website. If you look up CARE Consortium, pull that up. They'll talk about the science. They'll talk about the research. They will link you to many of the studies that are there around that. One of the best places to look is if you do a search on the concussion consensus statement. There's some tools that your providers use. We talked about a graded symptom checklist. So your doc, even your primary care doc, there's some tools on there called the SCAT-6 that kind of breaks down some of those. It can talk you through the same kinds of tools that we look at and use to assess and can educate you on that a little bit. There's some tools when we look at our different communities. So if you look up concussion and the group that I belong to, the American Medical Society for Sports Medicine, they'll link you to those consensus statements, link you to some of the best practices and the tools that sort of talk about head injuries, give some great information on what you do at home and how to take care of that.
From a neuropsychological perspective, the Sports Neuropsychology Society is a valuable resource for practitioners as well as for consumers. The Centers for Disease Control has a Heads Up program that's a great resource for all people involved in youth sports. They've got all kinds of rating scales and information and things like that. So,
awesome. Yeah, and a lot of those sites we can attach just on our website as a part of that as well, or even on the post. Just if you have questions, you can access that information.
And just to piggyback off of Alex's question for both of you, how do you determine reliability in the resources that you're consuming, like the research that you're consuming, or your prescribed treatment plan? If you want to determine if that treatment plan is good for you personally.
Yeah, I think from these resources that we're talking about, that's a big part of that. So when we talk about a consensus statement, that's just not one group. That's not just my medical society or Dr. Steed's medical society. That's really most of the important medical societies that talk about that get together and produce that consensus statement. And so when we look at that, that's everybody agreeing. There's lots of discussion on the nuances of that. So if it's in line with the principles they're talking about, you're pretty much on track. If it's not, if it's something else, like I heard from my friend's grandma that if you drink this special concoction, then you're going to be better. Those are things from a common sense standpoint you can look at and say, I don't know if this is going to help me. If somebody swears by it and it's your grandma, you probably should listen to grandma. But it's a good idea to make sure that it fits with science. And that's a great way to do that. If it's really out there, it's sort of that common sense, factor with that.
yeah,
Absolutely.
that common sense. And I would also add the findings have been reproduced. I think that's another good thing. I mean, the internet's an invaluable resource, right? It can feed your fanaticism and it can answer questions all at the same time.
Yeah.
For sure. Absolutely. So just kind of wrap up a little bit. My dad likes to talk about key points. What's the key? So my question for both of you is, are there key takeaways and key points that you have from concussion or from what you've researched over time?
Yeah, I think concussion is manageable. I think good news is I think we have good information. We have good treatment regimens. We have a lot of people that are improving in their education about management of concussion, and we're learning more about it, right? And by extension, we're learning more about youth and how they respond to concussion and how to help manage them. And so there are a lot of resources that are involved in helping people to get better, and most people will recover completely from a concussion and allow you to resume doing the things that you need to do. It's important to manage it appropriately and seek out professional consultation when you need to.
Yeah, I agree with that. I think that's right on. I would just add really kind of the important points or go ahead and don't be afraid of being evaluated and being diagnosed. The diagnosis comes from a very defined process, and with that we can start the treatment as quickly and as efficiently as possible. The most important take-home point after a concussion is it needs to be healed all the way before you get put in a situation where it can happen again.
Yeah.
And if that happens, we generally don't see significant long-term problems from that. So I think with those principles, address it. Don't be afraid of it. Get it defined. Take care of it the right way. And then we get you back to your sports, get you back to those things that you love.
Yeah.
Yeah, absolutely. I think it takes a whole team. So yeah, thank you for
that's
this.
great.
Yeah.
Thank you for your time. Thank you for being here, and thank you for helping out with the Strong
Yeah.
Youth Project.
Sharing your knowledge. Absolutely. Yeah. Thank you.
Thank you.
Thanks for having us.